The biotech company has raised $70 million in a placement of new shares, highly unusual given its market cap of just $16 million going into the trading halt for the raise. To explain, Radiopharm Theranostics, Paul Hopper joins us now. Thanks very much for talking to us, Paul. Welcome to ausbiz. So you've completed a $70 million placement. Just explain the reasoning for that.
Well, we did the placement because we needed the money, but to pick up on your comments about how extraordinary this was, the company was trading at a market cap of about 15 million. So how do you go about raising 5 times your market cap at a premium to the share price? So really the catalyst for this was that the world's largest radiopharmaceutical company called Lantheus, which is a NASDAQ listed stock, took an interest in the company and declared their intention to take up to 19.9%. So that was the catalyst that told the market that we really had something. And after that, we had investors chasing us nonstop to be part of it.
In fact, can you tell us a little more about Lantheus? Because it's a cornerstone investor for you, isn't it?
Correct. I mean, these guys are the global leader in radiopharmaceuticals. And as you probably know, radiopharmaceuticals are a way of using radioactive isotopes to either take pictures of cancers or using them to kill cancers. And Lantheus is the biggest player in the imaging side, and they want to move into the curing side, which is what we call the therapeutic side, which is where Radiopharm is quite focused. And so having them come aboard gave a lot of investors the confidence that our business was credible and that we had a exciting portfolio of products.
Well, in fact, you got that collaboration with Lantheus for the development of one of your key products there. What I understand, a study is underway in New York. Can you tell us a little more about that?
Yes, so we'd known when we IPO'd the company back in 21, and we knew Lantheus because we shared a common product. Lantheus owned the imaging side of the product and we owned the therapeutic side. And so we got to know each other quite well. And I guess them finally winding up as a shareholder was a logical conclusion.
If we look at what's going on in this space at the moment, I mean, you only have to look at a couple of other stocks to see how excited the broader investor community is at the moment. So clearly you've managed to take advantage of that.
Yes, look, it's one of the hottest spaces in oncology today. The great success story is Chris Behrenbach's Telix, which has been one of the most extraordinary stories in the biotech or any industrial company, because he now has a company generating income and profits. So what has happened is historically you had chemotherapy, you had surgery, you had external radiation, and then 10 years or so ago you had the immuno-oncology revolution with cell therapies. This has radiopharmaceuticals, that is using a radioactive isotope to cure cancer or to image it. This has the potential to be a whole new front. And the investment world, the life science investment world, is acutely interested in it. We did, my CEO and I did 55 presentations throughout the US over the last 3 weeks. That's the level of interest that the market has in this sector now.
So specifically, what are you offering given what's going on more broadly in the sector at the moment, the products that you're using to both diagnose and then obviously to treat these cancers?
So we the 4 products we have. The first one is an imaging product from Imperial College in London, which I licensed from in 2021. That's going into a phase 2B clinical study, and it's for brain metastases. That is for cancer, primary cancers from other parts of the body which have spread, metastasized into the brain, and many, many cancers do that. So that's an imaging product, and that's a large market. That's almost as large as prostate cancer. The second one is a pancreatic cancer imaging drug, and as you know, pancreatic cancer is a deadly cancer, and this is an imaging product which produces particularly fine, clear images of the cancer as well. And then the third one is a breast cancer therapeutic drug. This is where we're actually tying a radioactive isotope, think of like a little nuclear warhead, to an antibody, and the antibody drags that to the breast cancer cell and sort of blows it up, to put it in simple language. And the fourth product is a drug for non-small cell lung cancer. And again, this is a therapeutic one. This is for attempting to cure. We tie a nuclear warhead or a radioactive isotope to an antibody, and it drags it to the non-small cell lung cancer and hopefully destroys it, and the patient obviously is on their way to recovery. So they're the four main products we have.